So which is better, a resident doctor job or a medical typist? Well, it turns out you can be both at the same time, at least according to the selection criteria from this recent job posting. Today I wanted to talk about seemingly weird selection criteria in jobs and a concept called job analysis and design. So if you're part of my audience that just watches my videos just to find out how you can land a job, feel free to switch off about now. But if you actually want to learn a thing or two about what recruiters are thinking when they put job ads and job descriptions together so that you can actually better prepare for things like your job application or the interview, then you might want to keep watching this video because you might just learn something. Hello, I'm Anthony, I'm the Career Doctor. I'm here on YouTube to help you manage your career. You may well have a question or a comment or observation about this current video, so if so, please leave me a comment in the descriptions below, or leave a like if you liked it, or thumbs down if you hated it. And while you're here, if you're enjoying my videos, please subscribe and turn on notifications. So let's unpack what seems to be on the surface a seemingly ridiculous selection criteria. After all, last time I checked, typing wasn't on the curriculum of any of the medical schools or postgraduate courses that I'm involved in as a teacher. On the other hand, completing paperwork, or maybe better termed these days, computer work, is a key and significant part of any junior level trainee doctor job in a modern hospital these days. In fact, many of the interns and residents that I talk to often reflect that their work days are filled up with completing recharts and discharge summaries rather than actually doing real clinical medicine. They're actually often quite tactical about when they do their computer work. In fact, they will avoid peak periods like the 4 o'clock period when they know everyone else is online trying to do the same thing so that it makes them more efficient in their work process. So if we're to look at the components of a resident role, typing, or at least data entry or getting the information on the system, would seem to be important from both an efficiency and performance perspective. So typing speed would be vital. And when you consider that the average person apparently types around 35 to 40 words per minute, but a professional typist generally types somewhere between 65 to 75 words per minute, then there's a lot of scope for improvement, isn't there? And typing at 30 words per minute is probably a fairly low bar, which most candidates will cross anyway. So we call this a key result area in the human resources language. And as far as KRAs go, it's a pretty well worded KRA. It's both specific and measurable, as opposed to most other selection criteria that are written in medical jobs. Now this KRA would come at the end point of what's called a job analysis. You see, a best practice way of determining the selection criteria that you put forward for a job is to start off by gathering information about the key tasks that are required to perform that job. And the best way to do this is to ask and observe job experts, which are otherwise known as the current incumbents, so the doctor's actually doing the job. You collect up all these tasks and then you seek more information about which of them are the most critical and important. You might also bring into bear something like a capabilities framework like the CAMEDS framework. And from all of this, you develop your key selection criteria. This should then go on to inform how you actually select the right candidate for the job. So if a key selection criteria was typing speed, yes, you guessed it, the best selection method would be to literally get the candidates to perform some typing, a typing test. This is what's called a skills test, and it's a really underutilized selection tool in medicine. By the way, if you want to check out your own typing speed, you can go to this site I found, LiveChat Inc., and do yourself a free test. Turns out I'm not quite a pro at typing. So, okay, we're now literally talking about getting trainee doctors who are applying for resident jobs to perform a typing test. And whilst I do admire the recruiter here for putting in an authentic and results-orientated selection criteria, here's the problem. You see, according to a site like PayScale, the average typist salary in Australia is around $26 an hour. But the resident salary rate in Australia is somewhere between $35 an hour in Tasmania at the bottom and $42 an hour in Western Australia at the top. So we're not being particularly efficient in using medical staff to enter data when this data entry could be performed by other people who have the right training but require lower payment. And arguably, if we did have other people performing these tasks, it would free up the doctors to do other tasks which are more specific to the training that they have had. We call this job redesign. Now, I hear you saying, but it's not that simple, is it? The doctors are the ones collecting information in the first place, so maybe it's just better and more efficient if they enter the information themselves. And yes, that is a fair point, but consider this. Medical scribes, which is a concept developed in the United States, so far as I can tell, are becoming quite popular here in Australia in areas such as general practice. A medical scribe is a person or paraprofessional who specialises in charting patient encounters in real time, such as during medical examinations. They also find information and people for the doctors and complete forms that are needed for patient care. So they're often shadowing the doctor and recording as the doctor is doing their clinical work. So, to sum up, when a manager posts a medical job description, they have often gone through a process of reviewing the key tasks for the role in order to determine the best selection criteria. So these selection criteria should give you a feel for the key challenges of the position, as well as how you might have to provide evidence in regards to how you demonstrate the ability to rise to those challenges. But sometimes this process of job analysis raises some other interesting questions. And in my opinion, it's not just good enough to develop the right selection criteria based on the task analysis at hand. We also sometimes need to question whether we have the right person doing the task in the first place. Sometimes a job analysis should lead to a job redesign. I hope you're enjoying these videos. If you liked this video, please leave me a like or a comment in the description below. If you're watching more than one, please subscribe and turn on notifications. And I will see you in the next video.